bonding agents that are out there are marketed to basically say they are compatible with both self-etch and etch and rinse techniques, meaning that you can either use the acid that's already in the bottle itself in a one bottle system, or you can do a separate etching step, whether or not that's, selective etching or total etching. So fifth generation is probably the most common and the most popular that we're still using nowadays, meaning that we still use the blue etch and then we follow it with a one bottle application with a light cure to harden the bond. This application is super simple and it does really become universal, right? The bond, in addition to the cement, and use both of those at the same time, can basically be used for any indirect or direct restoration. They're compatible with every metal, every zirconia, every ceramic. And then what these two in conjunction allow for is a minimized inventory, which is a main thing, right? A lot of us who are practice owners are worried about overspending on inventory and having things expire. With this, you can basically use them in almost every situation, and you're probably going to use them up before you have to throw them out. This is using SSM2 and Tokuyama Universal Bond, and these are kind of going through the steps a little bit here. So here we have number 11. I believe the patient broke his previous restoration or cracked it. So this is a replacement of an Emax crown that was placed. And as you can see, the patient has some anterior restorations in 7 through 10, as well as 12 and 13, or I guess just 12, are in Emax as well. So we're using a total etch technique here. You etch for the 15 seconds, you rinse and you dry the restoration. Over here on the right, you see one of the wells. As you can see, even though we have two bottles of bonding agent that we have to mix together, you actually move it into one. And you see it has this kind of cool blue color, which most of our bonding agents are yellow, right? Those yellow in our bonding agents can actually also discolor some of our restorations. You just mix it together and you apply it to the tooth. And the best thing about it is you apply it to the tooth and you air thin it. There is no light curing necessary. And then you can even take another brush and you can put it on the intaglio crown, and that primes or silinates the intaglio of all ceramic crowns. You could also do this with a metal PFM, and you could also do this with zirconia, and it would work just as well, and actually you would have a chemical adhesion. And the last thing you do, like I said, you just air thin it, and then this is where you kind of test out to make sure everything is completely dispensed. You'll see here, this is actually the clear or translucent version of the cement. So when it's first dispensed, it has a little bit of an opaqueness to it. And then you just place it in, and then you can actually push it down, and you see you have a nice thin layer of cement all the way around the tooth. And then you can actually spot cure this, and then you can actually kind of peel it off in a gel phase. So you spot cure this for, I believe it's 2 to 3 seconds, and then you're able to peel it off like, almost like a sticker all around the edge of the tooth. And you just clean it up. And what you end up with is, a very nice, very simple, straightforward restoration and cementation. Shades are always hard to pick. So I like to say this, pick a shade, any shade, right? You get teeth like these, and these are a nightmare, right? You've got either decay that you have to deal with, or you have to deal with a big class 4, anything like that. This is so stressful a lot of times because a lot of us don't carry shades A1 through D4 in our office. Here's my first case that I've done, which is shade A1, and I used both Omnichrome and Omnichromo blocker in this one. I think this restoration turned out very well. This is an immediate post-op, and you can see the size of this restoration, right? I used blocker on the lingual, and then normal Omnichrome on the facial, and look how it polishes super nice. Here is another case that I'm really kind of proud of, and I did a great job on, I believe. I actually had this published in Oral Health magazine in Canada, talking about a diastema closure using again, all 4 iterations of Omnichroma. So you can see this is the pre-op here on the left. And then if I take that away, you can see all that gingival irritation from a poorly contoured restoration. So I kind of did this gull wing preparation here. And then that's I believe a 1-week post-op on the left. And then you see that's a 6-month post-op 6 months later when he was in the hygiene room. So you can see that this blended in very well. His gingiva healed very nicely, and we actually have a nice blend in there. And then, believe it or not, a lot of these incisal edges of these composites I also fixed on 7 and 10, which most of you probably didn't notice too much.